Hi. No, a cavernoma is not a brain tumor. A cavernoma is in the spectrum of what we call a vascular malformation. It's an abnormal formation of um, blood vessels or a sort of a blood lesion, but it's certainly not a tumor. So it's not something that tends to grow or require tumor-based treatments or tumor therapies, but really it's something that can bleed at some point in people's lifetime, and that's the reason why we consider treatments for them. Well, a cavernoma can be anything in a spectrum from a completely incidental finding, which never requires any treatment or removal or even surveillance, to one that can bleed in quite an important part of the brain that does need to be removed or needs to be treated with potentially with focal radiation treatments like radiosurgery. So there is a very broad spectrum of cavernoma, and it depends on the location of the cavernoma, a particular cavernoma's behavior, and also I suppose the patient themselves, so the extent to which they are symptomatic or experiencing problems with their particular cavernoma. Again, the symptoms of cavernomas are quite variable, and it really depends on the location of the cavernoma. Cavernomas can cause bleeds, and typically speaking, these are very small encapsulated bleeds in a particular part of the brain. And a bleed might cause, for example, an acute headache. The bleeds can cause seizures, or just the presence of the cavernoma can cause seizures or epilepsy disorders. And then they can also cause what we call focal neurology, and that essentially means symptoms related to that particular position in the brain. So if you happen to have a cavernoma in your speech area of the brain, you might have a speech problem. If it's in a motor part of the brain, you might have a weakness, for example. But if it's in a part of the brain that does very little, you could have bleeds from a cavernoma that cause no symptoms at all. Well, I would say that there are three primary treatment options, and I would include in that surveillance and conservative management. So the first option really is to monitor the cavernoma, to monitor a patient's symptoms, and potentially, if it's a cavernoma that's changing or is symptomatic, to perform serial scans. So we might do a scan once a year or every few years, or just do a scan if it is symptomatic. The second option is surgery. So surgical excision is a very effective treatment for a cavernoma if it can be done safely. So if you remove a cavernoma, then there's no further risk of bleeding or problems in the future as if that's successful. But there are only certain cavernomas that are amenable to surgical removal. So if your cavernoma is in a very difficult, deep location, and you might cause more harm than good than trying to remove it, then it's not feasible. But if it's very superficial, then it can be removed. And the third option is really focused radiation treatment. So there are a number of these different kinds of treatment. Gamma knife radiosurgery is one, or cyberknife treatment. And that aims to deliver a very focused beam of radiation to the cavernoma to prevent future bleeds. So it doesn't remove the cavernoma, it's still there. But if you give it a very highly focused beam of radiation, which is done as a day case, potentially you can reduce the risk of behavior in the future, such as a bleed or growth. Absolutely. So exercise is good for you, and a cavernoma is actually not part of your normal circulation. So things like changes in your blood pressure or excessive activity shouldn't affect the risk of bleeding or activity from a cavernoma. And in fact, the large majority of cavernomas are asymptomatic incidental findings. So if you have a scan, you're diagnosed with a cavernoma, I would very much recommend that you shouldn't really change your activities too much. I wouldn't suggest that you suddenly stop exercising or doing daily activities which are good for you, because you're not really going to alter its behavior, and the large majority of them are asymptomatic and don't cause difficulties. If you have a cavernoma which is causing problems, for example, epilepsy or neurological symptoms, then I think you can alter your behavior according to the symptoms, but I wouldn't suggest to do that because of the cavernoma. Well, one of the key questions that we're attempting to address at the moment is really that question of whether patients benefit from treatment with either open surgery, focused radiation treatment such as gamma knife radiosurgery, or conservative management. And it's quite a controversial area in cavernoma management. So I'm a principal investigator for the CARE trial, which is cavernoma, a randomized effectiveness trial. And that's a national and multinational study looking at comparing patients who have surveillance versus radiosurgery versus open surgery. And the reason why the trial exists is because there is a degree of what we call equipoise between the benefits and risks of each option. And there is evidence in the literature and worldwide about the effectiveness and the risks and benefits, but this evidence is not gold standard evidence. So it's still on a patient by patient basis indeterminate often whether or not they should have an intervention or not. So the CARE trial aims to address that question and is funded by the National Institute of Health Research, and we're recruiting at the moment. So a patient who's entered into the trial will receive all the information about the risks and benefits of that. They will have guidance on which treatments might be suitable for them, and then depending on which treatment they have, or if they have surveillance, they'll then be followed up within the trial in a structured fashion. The CARE trial was conceptualized in association with the Cavernoma Alliance. So the Cavernoma Alliance reviewed the top research questions in the management of cavernomas, and the question of whether conservative management, surgery or radiosurgery were the best treatment options came as top of their assessment of questions of patients with cavernomas. So that's the reason why the CARE trial exists, and we're very much recruiting at the moment for patients who would like to be involved.